Hi, this is Dr. Montagna. We're continuing to talk on Lyme disease today. This section is going to be about diagnostic testing and some of the fallacies with that. When we look at laboratory tests for Lyme disease, there's two different kinds of tests. There's indirect tests and there's direct tests. With the indirect, those are your immune assay types of things called ELISAs. That's your Western blot, your IFA, T-cell. The proposed reporting criteria for the Western blot are really grossly inadequate, and it excluded 69% of the infected children. Some people did research a while back. They took 516 lab samples of blood. They took 3 samples of blood out of different people. They labeled them very carefully, logged the labels, and sent them all over the place. Sometimes 3 of those same samples from the same person would go to one lab. Sometimes one sample would go to 3 different labs. Out of those 516 lab tests, no 2 results were the same. Researcher Tom Greer says this is an outrage. The test should be outlawed, not even be able to be used. They claim the ELISA accuracy is 45%, or they used to. They don't publish what the accuracy anymore. But with that one research, it really makes a test questionable. And the direct detection test, those are really, really a difficult issue. It's a real needle in the haystack. You have to get a sample directly from a place that's infected, and how do you know where it's infected? Medicine has no way to do that. There are some alternative ways where you can find general areas, but an exact place to put a biopsy needle to direct it to collect a live sample of any of the infective agents that are associated with Lyme disease is, boy, it's like trying to grab a needle out of a haystack when you're driving a car 60 miles an hour down the road and picking that one piece of hay a mile down the road and making sure you pull it out. It's a statistical impossibility to be able to do it. So it doesn't make those tests very, very good. Centers for Disease Control talked about testing on rickettsia many years back. The greatest challenge for clinicians is difficulty in the difficult diagnostic dilemma posed by these infections in their early clinical course when antibiotic therapy is most effective. The old standard was they expected those tests to be about 20% accurate in the first 2 weeks of infection. After that, they actually fell off fairly dramatically, and now they don't publish those results. Tom Greer wrote a paper on why the controversy over diagnosing and treating Lyme disease. In that he cites 36 different studies, so this is a review paper. And he talks about in 82 when the cause of Lyme disease was known to be a bacteria. Early medical papers reported that 2 weeks antibiotics should be adequate to take care of the problem. He cites 5 studies with that. There's dozens of medical papers since 82 documented antibiotic failures in the treatment of Lyme disease. And with that, he's citing the bulk of those 36 studies. Every antibiotic treatment study since 1982 that followed Lyme patients post-treatment for at least 3 months shows relapses occurring. In other words, all of the studies of the common therapy are riddled with failure, and yet the treatment doesn't change. If you like this, hit the like button down below. Subscribe to our channel. We'll be back with more interesting videos on Lyme disease.